My name is Donovan Coffey, and I was treated at the University of Iowa Hospital for a disc fusion. We live on 64 acres of land, and I enjoy being able to be outside, pretty active in raising honeybees, and I love that quite a lot. And it's kind of one of those hobbies where you find a passion. It puts me in touch with nature, and when you're dealing with a colony of bees, they have their own little society and their own way of doing things. It's almost kind of a Zen-like experience, and over the course of the summer where this really started to afflict me, it was a chore just getting outside to take care of the basic necessities, and it was not an enjoyable task at all, and I did the very bare minimum I could. The symptoms that I experienced started with what I thought was a shoulder injury, and it was while I was exercising and working out. I thought I'd overstrained, and over the next few weeks it not only got worse, but it got to the point where that pain started manifesting and radiating itself down my arm into my tricep and into my fingers. Started going through physical therapy. I went through the process of having cortisone injections. Neither the cortisone injections nor the physical therapy really helped the pain that I was feeling. By the time that I had spoke to my general practitioner here in Dubuque, I was ready to do something to relieve the pain that I was feeling. So I asked for a referral and was given a referral down to University of Iowa Hospital. My intention going down there was to beg the doctor for surgery when I got there, and I didn't have to do that, but he made that an option for me, and it was clearly the best decision from a medical standpoint that I've ever made. Well, my experience with the University of Iowa Hospital, I've been down there not only for myself, but for my family as well. And the process from where you park to the admitting process, you don't even think you're at a hospital. I don't know that I waited more than 5 minutes to go through any different thing or to wait for a nurse or a doctor to come see me or tell me what was going on. The procedure that they performed to fuse the discs together, they made an actual incision in the front of my neck, and from the second I woke up in that recovery room, the pain relief was instantaneous. They came up, took me for a walk, and I just wanted to keep walking. In fact, I think I got up. I don't know that I slept more than 2 hours that night because I was able to move without pain. I was able to walk without pain, and it was the first time I'd been able to do that in months. Any movement that I need, whether it's side to side, peripheral movement, I have all that. To be able to go through this process and that procedure and to be able to be out there enjoying what I love to do, I feel very fortunate. As far as recommending University of Iowa Hospital, I would do that in a heartbeat. My wife is treated down there, and so I've always had an affinity for University of Iowa Hospital from the level of care that she's received. And I can tell you that was only compounded from my experience with them. I would absolutely recommend University of Iowa Hospital.